my name's Courtney Clark, and I'm a child life specialist, and I have the best job in the entire world. It's a child life specialist job to make sure that when kids, just like you, come into the hospital, that you feel comfortable, safe, and that you know exactly what's going on with your body. It's also my job to answer any questions you have, and the best part is I get to have fun. Today, you're going to be getting an IV. An IV stands for intravenous, which also means into the vein. We call it inserting an IV because we insert a catheter or tube into your vein, which allows fluids like water and medicine to go right into your body. Your veins are the bluish-greenish lines that run up and down your arms, and they also run all throughout your body. They're easier to see on some people than others. If you're having a hard time seeing your veins, try squeezing your fist tight for about 10 seconds and then look up and down your arm and you should be able to see them. Do you know why we need IVs? Like I told you, you can see your veins in your arms, but they run all throughout your body. When we put medicine in through an IV, it's the quickest way that we can spread medicine all over our bodies and fix whatever's hurting. When we're sick, we don't always get the proper nutrition, and sometimes our bodies can become dehydrated when we don't drink enough water. That's why we could also put fluid through our IVs to make sure our bodies are nice and hydrated and we're not losing any water.
The first type of IV catheter you will learn about is a peripheral vein catheter, or PVC. This is the most common type of IV and is inserted into your forearm or hand. This type of IV is used for short term, meaning it will be taken out or changed every 3 days. This type of IV is used to deliver fluids, like water or medicine, right into your body. The type of IV catheter you will learn about is a central venous catheter, or CVC. These IVs are longer lasting and are the fastest way to get medicine and fluids, like water, circulating through your body. These IVs can be placed on the inside of the arm, neck, or chest, but this type of IV has to be put in by a doctor.
Now, using some special equipment and my little doll over here, I'm going to go through the steps of getting an IV with you. First, the nurse is going to take a good look at you and decide where the best place to put the IV is. IVs can be put in any place all over your body, but usually you'll get an IV in your arm or in your hand. Once the nurse decides where your IV is going to go, they will put a spray or lotion called lidocaine on you. This will numb your skin so you can't feel a thing. After the nurse puts on the lotion or sprays the spray, they're going to take this little rubber band looking thing, it's called a tourniquet, and they're going to tie it around your arm. This will help them to see the veins a little bit better, kind of like when you squeezed your fist. When you tie the tourniquet around your arm, it might feel a little tight, but it won't hurt. Before we put the IV in, we have to make sure that your skin is very clean in the area where the IV is going to go. The nurse will have a little moistened pad that might have soap on it, or a little sponge that they'll dip in soap, and they'll use to clean the area. Once your skin is nice and clean, the nurse will insert the catheter or little straw into your vein. You might feel a teeny pinch because it does have a little tip on the end that helps it lead into the vein. But as soon as it gets into the right spot, the little tip comes out and only the straw stays in the vein. After that, the nurse will put some tape and maybe a little pad to keep your IV in place. During your IV, it's really important to stay as still as you can and take nice deep breaths.